Welcome, everyone, to today's webinar. This is a part of our Healthcare Experience Foundation Learning Series. My name is Katie Owens. I am our president and co-founder, and I am really thrilled that you are devoting your most precious resource, your time, to our conversation today. Physician onboarding is candidly one of the most requested topics that we get asked to support organizations with, to provide best practice resources. And so I'm really thrilled for our agenda and conversation today, and joined by my colleagues, Dr. Rob Minkes and Dr. George Mayzell. We're going to explore the need to expand physician onboarding as a critical strategy to support your retention objectives. And in reviewing your feedback prior to today's webinar, that was a big area of focus that you've requested, is how to connect onboarding to different retention metrics and strategies. We're going to review some high impact opportunities that we're seeing across organizations to prioritize and look at ways to expand and amplify your onboarding initiative success. And then we'll leave you hopefully with some practical ways we can support your physician onboarding efforts. Before we dive into our time together, for those of you new to our Healthcare Experience Foundation learning events, we are an organization that is focused day in and day out on supporting healthcare organizations with the fundamental premise that every person is worthy of an environment where they can both deliver and receive the best healthcare experience. And today we fulfill our mission by supporting you with a fast track to really equip candidly, a vulnerable area of your workforce in your medical staff, helping them feel confident, assimilated in your organization, and equipped to deliver excellent patient care. We support physician development through a number of ways at Healthcare Experience Foundation, from supporting graduate medical education programs with resident and faculty development, one-on-one personalized provider development, physician leadership development programming, and of course, the topic of today's conversation, physician onboarding and performance strategies. And I'm honored to be joined by my colleagues, Dr. George Mayzell and Dr. Rob Minkes from our physician coaching team, who are really going to facilitate our conversation today. And please let me remind everyone that feel free to chat any questions, share any observations or key takeaways that you've had.
Physician onboarding and orientation is an often overlooked opportunity that can help organizations attract top talent, which is a need for most of our organizations, create an environment where physicians, especially new physicians, feel welcomed, valued, and empowered to excel in their roles. And we know that when it's done right, our new provider hires can become the change agents and leaders we seek. And this isn't always an easy task in our current environment and current practices. As organizations, we've appropriately focused on contracting, credentialing, which can be a difficult process, and getting our physicians up and running as soon as possible. But we also know that the excitement of a first job, if you're fresh out of training, or a new job quickly evaporates if we do a poor job investing in the process. A well-structured onboard process integrates from the very beginning the recruiting and hiring process, sets a positive tone, and fosters that sense of belonging that can improve job satisfaction, retention, and even organizational culture down the road. I think overarching some of the punchline is making the process robust, yet individualized enough that it feels personal for the oncoming physician. So, George?
Right. Thanks, Rob. I think we all know intuitively that onboarding is important. We've all been in jobs where we've sort of felt very welcomed and easy. And, when you're moving into a healthcare job, you're often moving cities, you're often maybe leaving residency. And sometimes we forget just how critical it is to get past just the credentialing and the compliance stuff, which is always important, has to be done. What we sort of sometimes forget is that onboarding really leads to retention, and retention is critical. And I think most of us, know about all the challenges of practicing medicine today with burnout and frustration. And it's very, very expensive to replace a physician. anywhere from $250,000 to $1 million to replace a doc. Again, when you start thinking about not just the cost of the transition, but the time spent, the money spent on recruiting, the time spent in lost revenue while you're not billing for the new doc, if you can find that person. And so onboarding really takes on a life of itself, and frankly, is going to be a game changer for successful organizations. And again, it really does translate into real dollars. Again, past the compliance and those kind of things. If you can shave a couple months off by being diligent and tracking managed care payer contracts, that translates into real revenue. If you can get patients into that practice, you presumably you have an abundance of patients, or at least hopefully, but you got to get those transitioned to the new physician in a positive way where patients feel like that's where they want to be. And obviously, getting that person out in the community and having them feel welcome, not just into the hospital and healthcare system, but in the community. Because again, the goal is to make it a great experience, but also to have that person stay. And all that translates into sort of matching a good culture. So again, just simplifying things, you're attracting good candidates through word of mouth and through marketing. You're selecting a recruit, and we'll talk more about that later. But again, it's got to be a cultural match. Selecting the wrong person, there's not enough onboarding in the world that's going to make that a good fit. That welcome and onboarding and making that person feel like they've made the right decision, the assimilation, and then obviously we're going to talk more about this. But onboarding is really not an event; it's a process. It doesn't stop. So that engagement and retention, and ultimately offboarding when that person leaves, or having that person onboard other people. So it's really something that doesn't have a starting point and doesn't have an ending point. Again, onboarding is a really great opportunity to get that person integrated into the healthcare system right away. And again, you may be bringing the person into a group. There may be a hospital or hospitals involved, or the patient may be pure outpatient. He certainly or she is going to need to refer to other physicians. So the easier you make it, the more likely that person is going to have a good experience, make the right decisions, and fit into the process. Obviously, patient safety and quality and protocols are important, and there's also list of compliance and other requirements that have to be boxes have to be checked, but those are important, and you got to get them done. But that's not really going to lead you to a good fit and retention. So all those things, making it comfortable for that person coming in, and it's tricky because if you're in a system where you have a whole bunch of moving parts with a number of folks coming in, maybe some physicians, some APPs, their families are coming in. And we'll talk more about it, but there's a lot of things to keep track of because it's not just, again, compliance and credentialing. There's a lot more to it. Well, let's jump back and start at the beginning. And I mentioned this earlier. The key is to pick the right person. And, I know in some specialties, you don't have a choice. In some specialties, you're just lucky to get anybody. But obviously, the closer the values and the culture is to your organizational values, the better the fit will be. And some of those, making sure that person understands the values and the culture of the organization by talking to a number of people. Again, if you pick the right person because they've done their research and you've done your research, then the onboarding is a lot easier because at least you're not fighting different values and cultures. So again, can't say enough about that, but we will. So important stuff.
We're going to go over a few steps that organizations have used to be successful. And the first one is setting the right tone and building trust during this onboarding process. And this is crucial for successful integration and long-term satisfaction and all the positive downstream effects. And as George mentions, this starts with the recruiting and hiring process. This is our opportunity as an organization for our first impression, right? This establishes our credibility, our professionalism, our respect, empathy, how we're going to communicate. And as a medical director in the last organization that I worked in, we successfully adopted a concierge approach where we would really help our new hires and walk them through the most difficult processes. Instead of saying, oh, call this person, we took the concierge approach, which really had great long-term payoffs. And the next part of that is ask for feedback. Ask our candidates what can we do for them, and that goes to that personalized approach that we talked about. And our providers, our physicians and clinicians want to know how to be successful. They want to participate. We need to include standards of performance, organizational physician compacts if we have them, in the essential cultural components. It's important that our providers understand what's most crucial to navigating the organization. And we did this as part of our onboarding every month. Everybody goes on camera, introduces themselves, tells a little bit about themselves, where they're from, their role in their organization, their purpose. And we ask them to identify their leader, as well as something fun like a bucket list item or something they're proud of. What we realized is they didn't know who their leaders were. So this was a great opportunity to talk about the structure and how it's set up for their success, who they can go to. We were very intentional to repeat important aspects of our organizational structure, include our vision and values. We also addressed that we purposefully repeated some things they might get in organizational orientation. Right? If we don't point that out, it becomes a checkbox. We've already had that. We've already did this. So it's important to repeat, signpost, tell our providers, right, what's happening so it becomes integrated in what we're doing. And so by recognizing that and the aspect that all of our physicians are leaders really helps identify what resources they'll need to be successful. So George also mentioned that this is a process, and as organizations grow and become large, it's very difficult to keep track of who's doing what and where it's happening, as well as the responsible parties. So having a centralized process, whether it's an effective electronic tracking system, or even an Excel sheet that links everything together, can be critical for this process. George, do you have any other thoughts about that?
Yeah, I think there's some great software available out there to track this, especially if you're a big system that you can use. There's also a lot of checklists, and I found a couple on the internet when I was doing some research that are available for nothing. And so I think, if you're going to try to, I think it's impossible to do this job correctly without some form of checklist. And then depending on your size, some form of electronic tracking, even if it's an Excel spreadsheet for 2 or 3 people. But if you're much larger, I think there's some sophisticated software out there that helps, because again, I think Rob mentioned this. We don't see this as a 2 or 3 week process. This is something that really doesn't really stop. So that follow up at 90 days and 120 days and so on and so forth, you could never remember that without some form of tracking.
Mentorship or buddy system programs are essential, and more so than just what we might think off the bat, the benefit for someone coming fresh out of training or new to the organization, having a clinical mentor or administrative mentors. What this provides is our opportunity to give our established physicians and staff the resources they need to be successful, because we're all, and as many pointed out in the poll, looking for connection and cultural change. This is a way to bring those people back into the mix, provide them with the resources we're providing to the new hires, train them to be more effective mentors, give them basic coaching skills. And this really has a significant impact on the organization when we invest properly in this.
This is such an important opportunity, and it's really about assigning that, let's say, physician, a clinical mentor and maybe an administrative mentor, and then, encouraging them strongly to set up some meetings so that there's a contact there. And then, what I've seen this work is that when the physician in this case, has a question on how to get something done, because again, we all know healthcare is very local, and the way you get things done in some places is different. Who's the best doc to do this? How do I get a CPAP machine for that? Having the ability to text that mentor if there's nobody else around, or is really valuable. Or it may just be I'm having a political issue at the hospital. We know those never happen, but just in case. So again, having that contact point to help steer both the clinical side and the administrative side can be really, really valuable. But it has to be, I believe, a formalized program. Again, somewhat obvious, but sometimes gets overlooked is that internal and external marketing of, again, we're talking about a physician here, just for example, making sure that doc gets out there and is introduced to some of the key, either folks that are going to be referring to them or folks that they're going to be referring to. And so, getting out there and just, being visible, the internet access points, both internal and external to the organization, are really critical, and not something that's some people are comfortable doing without some help. And so that's where the marketing department can step in from the hospital or other folks. But again, making sure that some of those meetings are set up and some of those external exposure things are set up so that, again, the practice gets jump-started, and that's what you want. Okay, we could probably spend a whole hour on the EMR, but trust me, I won't. Obviously, almost every onboarding has some mandatory EMR training as part of either the Cerner or Epic or whoever, process, and I think that's good and important. But I think what I want to also emphasize, the EMR is such a big part of practicing medicine these days. And frankly, it's just such a huge dissatisfier in many situations. So again, it's not going away. So anything we can do to help that physician or APP be more successful and more efficient in how they manage the EMR access is really important. So helping them beyond those courses, but shortcuts, templates, some follow-up access, and knowing who to call to help when they run into some problems can be a huge satisfier, or maybe removing a huge dissatisfier is probably a better term. So don't overlook it and don't undersell the EMR piece.
And to the point earlier that George mentioned, that the environments are going to be different, and a small private practice where a senior partner is going to mentor a new partner, that might be more simple than, let's say, a large physician group with multiple components. With a surgical background, I have orientation for the organization, for the physician group, for my local practice, and all the hospitals that I'm going to work with. So they're very different, and the needs are very different. So it's important to identify that, keep the lines of communication, and even take inventory of what's known, what's not known, as you build a coordinated and structured process that includes some of the important aspects that we've talked about. And so the expectations, I think it's important to, again, realize that our physicians and clinicians want to participate, they want to integrate, and they want to be successful. So setting the goals of the organization, reinforcing them on a number of levels is important. The metrics, show them what's important to the board. What is our scorecard? Get them familiar with it, and ask them to, once they know who their leader is, review it and tie in what they do every day to some of these metrics. And it's not always obvious. It could be teamwork. It could be patient experience. It could be how we treat others. Tying that in has a lasting impression. Participation in this process is very important. And in my experience as a medical director, when we partnered with our recruiting teams, with our hospital teams, in our local practices, and participated in the onboarding process, it made a big difference. So our orientation included leaders, it was run by medical directors. Our chief medical officer and chief administrative officer participated in a question and answer forum as part of that. That's important. That's important for that welcoming process, to give the idea that we have an open door policy, who you can go to next, and find out all along the way, what did we do well? We start at our orientation. How did the recruiting process go? Right? What was your experience with credentialing? What could be better? And we take the feedback, and they see the change and help become part of the change, the leaders that we talk about. So our new hires become our vocal advocates of how it needs to be. And we're open about discussing some of the difficult issues. So if we don't prepare our new hires to the state of healthcare today, we have shortage of MAs, shortage of nurses, across the board, they think it's unique to the organization, and it reflects poorly. When we talk about it openly and come up with solutions and ideas, we really grow as an organization, and they feel valued by lending their input. And again, being intentional, scheduling these meetings, including physician leaders when possible. That's not always possible, but having other leaders, whether they're administrative, practice directors, practice managers, give feedback, establishing that feedback culture is essential.
Okay, who's been in a situation where a doc is leaving the area, and when you ask why, the answer is, well, my wife or my husband was not happy. That happens a lot. So I think, you've got to remember, this is a family unit. Oftentimes, folks are moving as a group. So you can't forget about the significant other or the spouse in the onboarding process. And the onboarding is different. So who do I see? Which dentist do I take my kids to? Where's the best private school? Is public school safe and a good school? What about churches or synagogues or other religious? How do I get my banking done? I mean, those seem like kind of silly things, but if you're moving into a new area, who do you ask? Spouses reach out to other spouses that from, folks that are in the community to the new spouse or significant other. Again, making them feel welcome, answering, those questions that are sort of silly to us who live in a community for years. But, I've been into new communities, and some of the simplest things, you're just trying, where do I buy a house? Where's a good area of town? What about the road systems? I mean, silly things, but they come really important. When you do them wrong, you understand how important it is to ask the questions up front. So really, this is an important area that so often gets overlooked because it's not in folks' wheelhouse up front when they're thinking about the pure professional onboarding.
If I might interject, we had a great question come in. Are the various mentors from within the department with the physician or member of the medical staff will be working in, or do you recommend from outside the department or a combination?
I think it depends on, where you are and what the resources are. I think if I really had my druthers, it would be someone in the same specialty area inside the department. If that's not always possible, maybe sort of somebody an adjacent department, like let's say, maybe perinatology could be OB or something that's related. So there's that connection in terms of the working relationship. But, it honestly doesn't have to be, because a lot of this is not going to be somebody I'm asking medical questions of. This is going to be someone I'm trying to figure out how I get things done. How do I get a stack consult done on a Sunday night? Who's the best, those kind of things that the working process of getting things done in a healthcare system that you're not familiar with. So I think that's the best answer I can give. Rob, anything you want to add?
Yeah, I would add that, clinical mentors is one thing, but much of the mentor programs that I've been involved with are around the cultural and connection aspects.
Right.
And having people remote from your practice where you might be having some frustrations, and having that really sacred a relationship with a mentor or a coach distant from that is beneficial. So where I came from, we put physicians, leaders, and people wanting to be leaders through traineeship programs, and those part of the program was they would be trained to be the mentors. And there were group mentors, individual mentors, and oftentimes it was most effective when it was outside of the department. So depending on the need, I would say that's the best way to go. So it's a combination of all of the above.
No, I think that's a great point. And in a highly political environment, that's probably perhaps better. In an environment that's maybe less political, maybe not so necessary. So yes, I agree. Onboarding is really, it's an ongoing process that really doesn't necessarily end at any point in time. You want to be connecting back at 90 days, of course, but also in 12 months and maybe also in 18 months. Set a schedule that works for you guys and just touch base back. And then, in a best case scenario, you take that person and you say, well, what do we do right? What do we do wrong? Maybe you want to help us for the next round, and you want to be a mentor next time to somebody because you've just been through it. So again, it's an ongoing process that keeps going and doesn't really end because, again, this is your culture. This is what you're building. So that connectivity is key, and it can't end just at 30 or 60 days when the credentialing and compliance piece is the boxes are checked.
I know Dr. Mayzell, Dr. Minkes, and I regularly have the opportunity to work across healthcare organizations, and we are happy to set up a follow-up coaching call with anyone that's a part of this conversation live or on demand to learn about your retention goals and performance, see if there's opportunities to elevate your onboarding and retention practices and create some sustainability modeling for you over the long term. And I know we are just at time.
Thanks, everybody.
Thank you, Dr. Mayzell and Dr. Minkes.
Yeah, thank you, everybody. Thank you, Katie.